Good morning, everyone. Thank you, sir, for the introduction. So I'll be speaking on the joys and dilemmas of pursuing international examinations. Normally, I do not display the post-nominal initials. I'm not fond of displaying them, but that is the requirement of this topic. So I have displayed, and I have had the pleasure of completing my FRCS and FICO. So during the life of an Indian medical postgraduate, he or she will come across this thought of pursuing the international examinations. Often we get this information from our seniors during our residency, during the second year or third year, and then we jump into the rat race of giving these examinations without making an informed choice. So it's a forced choice, often from our seniors. So today I'll like to discuss on that, and so that you may in the future make an informed choice. So there are two options for pursuing the international examinations. One can be the examinations to study abroad, which is not the topic today, which we will be discussing, but the other one is to gain some certificates or fellowships, international fellowships. So what are the common examinations that are being given or that are being undertaken by the Indian medical graduates? Our postgraduates are the ICO examination, that is the International Council of Ophthalmology, then the Fellowship of the Royal College of Surgeons, and there are three colleges in United Kingdom: the Glasgow, Edinburgh, and Ireland. And then there is a fellowship examination of the Royal College of Ophthalmologists, London as well. So coming to the International Council of Ophthalmology, it is an international body that aims to improve the ophthalmic education and patient care across the world. And these are the following examinations that ICU offers. And the initial examinations are the standard examinations, and then after clearing the advanced examination, you are eligible to use the acronym FICO, that is the Fellow of International Council of Ophthalmology. So combined, the initial part A and B examinations focus on the basic sciences, and then you have the clinical ophthalmology examination, which the syllabus of which is similar to the postgraduate examination, so you need not study anything different from the post-graduation. Then you have an advanced examination which you have to clear to get the acronym. And this examination is a little tougher than the clinical ophthalmology examination with a lesser pass percentage. And sometimes you need to clear a face-to-face ophthalmology examination also in certain countries to get this acronym. But in India, we do not need to complete the face-to-face ophthalmology examination. It's not mandatory here. And after clearing the advanced examination, we are free to use the acronym. Now, there are certain subspecialty examinations that have also been started by ICO in the last couple of years, and you need to have 1 year experience in the subspecialty to pursue that examination. Coming to the fellowship examination of the Royal College of Surgeons, the most popular is the FRCS Glasgow. And FRCS Glasgow has also 3 parts. Now the difference here than the ICO is that the part 2 also has some component of general medicine and neurology. And you should know about the acute management of the medical emergencies as well. And you can only appear for the part 1 examination in your second year of your residency onwards. And for the part 2 examination, you can only appear after you have 6 years of experience following MBBS, including internship. So once you clear the part 2 examination, you are eligible to become a member surgeon in ophthalmology. And once you clear the part 3, you are eligible to become a fellow. So part 3 is the toughest exam, and it is based on a structured oral viva and a clinical examination of real patients. There are certain exemptions which one can go to the website and see what parts can be exempted if they have covered the ICU exams. Then you have the fellowship of the Royal College of Ophthalmologists, London, and it also has 3 components, but the unique component is the refraction certificate. So you need to have a experience of performing 50 to 100 refractions. So you have to commit yourself to doing such a heavy refraction before appearing for this examination, because the pass percentage is as low as 25 to 30%. There are no exemptions for this fellowship. The benefits of appearing for these fellowship exams, international certificates, is that they'll provide you with the standard certificate that will validate that you have a knowledge of a standard ophthalmologist across the world, because the Indian education system is very diverse, and after post-graduation, some may do a senior residency, some may be doing a fellowship or MCH, that too of variable duration from 1 to 3 years. So it's not a level playing ground which is there, and each one of us may have a different education level. Now, other benefits of pursuing such fellowship examinations, especially if you are in a central government institution, if you are appearing for the UPSC examinations, then if you are a FRCS or FRC of fellow, then you get additional marks in the assessment. It's a roadway to the ICU fellowship. If you have cleared the standard and the clinical examinations part of the ICU, you can apply for international fellowships ranging from 3 months to 24 months, and you are provided a grant also in these fellowships up to the order of 5,000 to 6,000 US dollars. FRCS and FRCOP, they are also considered as a acceptable medical qualification for GMC registration. If you are planning to settle to UK later on in life, then you have to do FRCS and FRCOP, because these are the qualified qualifications that are required, and your post-graduation examination certificate will not be acceptable. And you are also exempted from appearing for the PLAB, which is required for GMC registration. You get a better remuneration if you're planning to settle to Middle East, and FRCS holders, they get a new remuneration up to the order of 5 to 10 times more than those who are not. Other benefits will be the Department of Personnel and Training, Government of India also provide incentives for achieving those higher educational qualifications up to the order of 30 to 40,000. And then some people would like to give examination because of the joy of using the post nominals. That is sometimes often required in the private practice also. You want to display the post nominals to gather the patient crowd. And then there are some who would like to give exams because of the joy of clearing those. Mind you, there is a long roadway. There are multiple steps in these examinations, and if you are sure you want to appear, then you have to appear for all the steps. There is no benefit of appearing and leaving it in the midway. There is a prolonged interval between these examinations, and there are limited centers and limited seats, so it may take few years, 2 to 3 years, to complete the whole fellowship examination. The prices are also high. For the ICU examination, it may take up to 1.5 lakhs to clear all the examination if you clear them consecutively without failing in any of the steps. And for the FRCS examination, your Part 3 examination itself is costing you 1.5 lakhs. And FRC of fees is even higher. In the Part 3 examination itself is costing you 1,94,000 if you're planning to appear this year. And the prices keep on increasing every year. There is a joining fees and annual subscription fees also. If you join these colleges, to avail their benefits, you have to renew your subscription every year. It's a tough assessment. At certain exams, you can have pass percentage as low as 33, especially the refraction exam or the FRC of, and it's Part 2 oral examination. These fellowships are no way a license to practice abroad. These are only a standard of your knowledge. These will not be equivalent to your licentiate exam, and these do not guarantee especially a job in United Kingdom if you are planning to go there. Now, how to decode the dilemma? You should assess your needs first. If you are planning to start your private practice here, there's no point of giving the examination unless you want a post-nominal acronym to gather the crowd. If you're planning to be in a government institution, in an academic institution, then you should go ahead, because you'll keep on learning new things with these examinations, and you'll improve your clinical knowledge and skills. If you have decided to give these examinations, then you plan these examinations in length, plan all the steps in the future, dedicate appropriate time and effort, because you'll definitely fail if you do not study for these exams at least for a few weeks before the examination. You need to brush up your knowledge. The ideal time to appear for the basic sciences examinations will be the second year or third year of your junior residency, and then the clinical and advanced examinations, the ideal time will be your senior residency. Choose a country logically. Where do you want to appear for the exams? Your domicile you want to appear, or you want to appear in foreign, but then there is a cost of travel and cost of examinations also. Now choose between the ICU, FRCS and FRCS, which one you want to give. If you want to settle in the Middle East, then you give the FRCS exams. If you want to settle in United Kingdom, give the FRC of the exam. If you want to settle in India only and you just want to use a post-nominal acronym, then an FICO is enough. And you can also apply for fellowships later if you have a FICO degree. So even if your dilemma is not settled, then you should go ahead with the examination, because you should keep learning. And always, if you stop learning, then you'll not be a successful person. You'll be a successful person only when you keep on learning. Thank you.
Thank you, Dr. Devesh.
Thank you.
And Dr. Tanay want to say something, comment.
I have done my ICU fellowship.
Okay, right. We have one speaker, Dr. Pratik.
Thank you.
And
Sir,
please go ahead.
So I had done my ICO fellowship from Wilmer Eye Institute under Johns Hopkins University. It's not just the acronym that we are using, but also like we get a different perspective, different exposure, like how meticulously they do their way of doing things and seeing the patients. It was a very good learning experience. If given the opportunity, I think you also try. Thank you.